So good morning, everyone, and welcome to the Retiree Town Hall. I'm Simone Parker with the CalPERS Stakeholder Relations Team. It's our privilege to host today's town hall and introduce your representative to the CalPERS board, Yvonne Walker. Before I do that, I'd like to explain the format of this meeting. Ms. Walker will be providing some updates on CalPERS, and then we'll take questions from you live. Everyone is in listen-only mode. If you have questions, when it comes time, you can raise your virtual hand and we will open up the line and call on you. You can find that feature at the bottom of the screen under reactions. Please note that we will be taking the questions live and not directly from the Q&A section. If you would like to turn on your closed caption, you can find that at the bottom of your screen as well. As a reminder, this presentation is being recorded. We have an hour together, so let's make the most of our time. And with that said, it's my pleasure to introduce Yvonne Walker. She is serving her first term on our board. Yvonne has served California and our nation for more than 35 years, working as a union president, retirement security advocate, and state worker and Marine Corps veteran. She's known for being one of California's foremost leaders in fighting for pension and health benefits earned by our retirees. Please join me in welcoming Yvonne Walker.
Thank you, Simone, and thank you all for coming back for our second town hall. I don't know about you, but I have been very excited about this coming up and look forward to more into the future. I want to say on the top, and Simone did mention that we will take the live questions. If you have questions in the Q&A, you can still put them in, but we'll get back to you. We won't be taking them live on the during the town hall. Just want to make sure that we're clear about that. And I also want to note, yesterday ended this month's board meeting. A lot of it we went with the investment committee and did review of the programs. It was a lot. I'm not going to have it in this town hall, but I will update you in the next town hall that we do about what happened in the mid-year review. So since our last town hall, the health of the fund has improved, but I will say that since we're long-term investors, we don't assess our progress in just a few months. But we do keep an eye on the data, and the data indicates that we should end the fiscal year with a positive return. We'll have more than $500 billion in assets. That's like $500 billion. We'll be roughly 75% funded and should see a 7.8% return through March 31st. So I think that's pretty good, and we should give ourselves a hand clap. I do want to now turn it to healthcare. And before I turn it to healthcare, just a reminder, I try to go through everything a lot and relatively quickly, because I like to leave enough time for us to engage in the Q&A. And so if you feel like I'm going too fast or anything like that, please let me know. And I'll try to slow it down, but I always like to leave a lot of time so that we can interact, because I think that's what these meetings are about. So on to healthcare. The board received our preliminary health premium rates this month for 2025, and it's going to be another year of increases, some of them tough. The primary driver of this is medical inflation and high pharmaceutical costs. But I will say the news is not all challenging. Because of the foresight and determination of our healthcare team, several of the plans are expanding into regions of the state that lack affordable options in rural areas. The final healthcare premium rates will come before the board in July for approval. So there is still time for our healthcare team to negotiate the rates further down. But to be honest, changes, if any, will be minor. And I know that many of you, because it was expressed to me, want to know the bottom line. How much am I going to have to pay? What will it cost me? And I will tell you those figures will come out after the board has approved the rates in July, and then they're able to, make the calculations. And as always, you'll be able to review your options for next year's coverage during open enrollment starting in September. Also in healthcare this year, this board meeting, we approved the 5-year PPO contract award. And this is one of the most important opportunities we have to put our leverage to work to affect positive change for our members and their families. The winning bids came from Blue Shield of California, a well-established healthcare provider based here in our state, and Included Health, a virtual healthcare provider that provides personalized services to patients, such as helping to find a provider, helping to find care, billing assistance, and accessing a mental health provider, and more. Pardon me. Both of those were chosen for their alignment with our CalPERS mission. The contract calls for each provider to reach milestones over the next 5 years to both contain costs and achieve patient health improvements for common health issues like high blood pressure, diabetes, childhood immunizations, colorectal cancer screening, and pregnancy care, to name a few. They will be incentivized and simultaneously held accountable for reaching both sets of milestones. But recognizing with this award that there is going to be some disruption because we're going from Anthem to Blue Shield. And for our members that are currently in Anthem, you should know that there is significant overlap between the Anthem and Blue Shield systems with providers and hospitals, but there's still going to be some disruption. Anthem has committed help with the transition, and the board and our healthcare team are committed to make the transition as easy and painless as possible for our members. To that end, we are going to bring on Included Health sooner, right? They will come aboard in after the board has approved in July the contract. And that way it will provide further time for our members that are in Anthem to be able to get help in figuring out, is my provider covered? What do I have to do if my provider is not covered? What's going to happen? Can we find another one? Those sorts of things. I will say that the board is committed to making sure that we stay on top of this. Our healthcare team is committed to stay on top of this as people are moving. Even though Anthem and Blue Shield, they share a majority of the providers and systems, there's still some gaps. And so what will happen is, one, Blue Shield to try to contract with the ones in Anthem that are not currently there, so our members will be able to keep their provider. But in the instance that that's not able to be done, our members will have, for their provider that's not covered by Blue Shield, they'll have 1 year of being able to still see the same doctor, and it will still be covered at the same rates. And that 1 year will give us more time to try to find a solution for our members. I think it's important to note that for the first time, our healthcare team was able to apply the same standards that we have for HMOs into this PPO contract. And that is historic. It is a very unique business model that truly has the potential to change the healthcare industry. And I predict that we will see this replicated across the country. So once more, CalPERS is leading the way. It's also important to note that our partners with Covered California and the Department of Managed Healthcare will be using the same quality measures. And what that means is that between our three organizations, more than 40% of Californians will be positively affected by better care. So I would just say this one more time, CalPERS is leading the way. Also, some of you may have heard about CalPERS and ExxonMobil. There's been a lot of information in the news. This is a newsworthy topic. And for us, it was about the subject of shareholder rights. CalPERS is a prominent owner of shares in a number of US companies. And that ownership gives us the right and the responsibility to ensure that company leaders are doing everything they can to ensure long-term profitability. But now we find ourselves with a major US company where CalPERS has invested more than $1 billion suing shareholders over their desire to speak up. And that company is ExxonMobil. And we think its leaders are making a mistake by trying to undermine shareholder rights. At Exxon's general meeting of shareholders, CalPERS cast our shareholder votes in opposition to all 12 members of their board of directors and its chief executive officer. Our CEO, Marcy Frost, and board president, Teresa Taylor, recently released an open letter to all CalPERS members to summarize the situation and why this case is so important. And so here's the long and short of it. As shareholders and publicly traded companies, we have a vested interest in how companies are run. Sometimes we're the ones putting forth a shareholder proposal, and sometimes we support the proposals of other shareholders. In this case, we object to the way Exxon is handling the proposal made by two shareholder groups. Instead of following the established rules for objecting to a shareholder proposal, Exxon filed a federal lawsuit against the investors. And even after the investors withdrew their proposal and promised to never bring it forward, Exxon chose to continue with the lawsuit. This lawsuit has a potential to create a far-reaching precedent that might silence shareholders at companies all across the United States. And while some have expressed the opinion that CalPERS is getting involved in social issues such as climate change, this is not the case. The board believes that we need to stand up for the right of shareholders to voice their concerns without being bullied or intimidated. Exxon leaders need to be held accountable. Our fiduciary duty calls us to a higher standard of how we conduct business. I hope that our actions start a conversation that will preserve shareholder rights that we have today, but also into the future. It should also be noted that this week, we voted against a multi-billion-dollar compensation package that Tesla proposes to give its chief executive officer. That package would allow Elon Musk to buy 304 million shares of Tesla stock at its 2018 value, which is currently valued at approximately $46 billion. This exorbitant compensation package is at odds with our longstanding views on executive pay. The compensation is excessive when compared to executives at peer companies. It's highly dilutive to our shareholders, and it isn't tied to the long-term profitability of Tesla. So those two things I think are important. With that, I want to open it up to any questions that you might have. We have an hour. Let's use it well. I don't want to waste your time. And then I'll come back and I'll do a closing.
Great. Thank you so much. So it looks like we have questions coming in. We'll start with Ms. Deanda. If you could take her off mute, Renee. Maybe I can.
Deanna, are you there?
Renee, are you able to unmute?
Yes, you should be able to unmute your microphone.
Okay, there you go. You should be able to speak now. If you're talking, we can't hear you. Maybe we'll try to come back to you.
Yeah, we'll come
Okay.
back to Deanna.
Okay.
And you want to make sure that as we take you off mute, that your own system isn't on mute.
Okay. It looks like you're off mute. Did you want to try one more time? No. Okay, we'll go ahead and go to, looks like Greg has his hand up.
Okay.
Hey, thank you, Ms. Walker, for communicating with us today. My name's Greg Lichtenstein. I'm a CalPERS retiree. 33 years as a physician at San Diego State. I'm also a survivor of the 2003 Cedar Fire that destroyed over 2,000 homes in my community and was an early warning of the magnitude of the climate crisis.
Absolutely.
I appreciated in an email response to your questions from the April 17th town hall that you stated, quote, as an investor in the global economy, the scale and multifaceted nature of climate change presents a systemic risk to our investment portfolio. Yet CalPERS maintains an estimated $14 billion in investments in companies that are literally fueling increasing global temperatures. You mentioned the issue of shareholder engagement, and I understand CalPERS has tried to steer some of these companies to greener energy production strategies, but it's had a negligible effect. Last month, as you mentioned, CalPERS voted in opposition to ExxonMobil's board of directors and its CEO in response to a lawsuit. And may I say that lawsuit was against two small investors who tried to introduce a shareholder resolution urging the company to work harder to reduce their greenhouse gases. Despite a $1 billion stake in Exxon, the board members, CalPERS $1 billion stake, the board members were overwhelmingly reelected with almost the same percentage of the vote they had received in a prior election. I appreciate CalPERS growing investments in climate solutions. These are good for the solvency of our pension pool and for the planet. However, the CalPERS board is to resist calls to divest from petroleum and natural gas industries and has lobbied next week in the California Assembly Public Employment and Retirement Committee. This bill would require CalPERS and CalSTRS boards to liquidate investments in fossil fuel companies on or before July 1st, 2030, and does not require the board to take any action unless the board determines in good faith that the action is consistent with the board's fiduciary or financial responsibilities that are established in the California Constitution. A similar bill in 2015 resulted in CalPERS selling its shares in coal companies. Many other public funds, including New York City, which recently divested $4 billion in fossil fuel companies, have begun selling their stakes in these corporations, recognizing their fiduciary duty to get rid of these risky investments. It's time for CalPERS to do the same. Can I have your assurance that you will work to convince your fellow CalPERS board members that fossil fuel divestment is in everybody's interest? If not, why? Thank you for your response. And by the way, climate change is not just a social issue. It's a threat to the health of the environment and the people who live on this planet.
Well, Greg, you said a lot, but I do agree with a lot of what you said, and I agree that climate change is not just a social issue, but that's how it's being framed by a lot of folks. And but thank you for correcting and pointing that out. And I will say that we continue to work with the author of the bill to get to a place where the board can support. And so it's not that we believe that as we move this forward, right, that we have to do it in the way that's going to make sure that we're doing our duty and protecting our shareholders and continuing to be able to pay out our retirement. I will give you, Greg, my personal commitment that this is a conversation that I will continue to have with my fellow board members. And I appreciate the fact that you modified it and didn't say that I had to convince all of them, because I've never been able to convince everybody of everything that I want to anyway. But that doesn't mean that I will not keep trying to get us all on the same page and moving in the same direction. And I will also say that we're not, there's nobody on the board that doesn't see the importance of it and that we're very far apart. And so I think as time moves on, you'll appreciate the work that we're doing. But thank you for your comments and question.
All right, thank you. So we'll try Miss Deanda again to see if we can get her audio working. So if you want to try to take yourself off mute and try again. No, it doesn't look like it's working. All right, well, I mean, in this situation, if you want to put it in the Q&A, I'm happy to read it for you since you can't get your audio to work, and we'll move to the next person. It looks like Brian, I believe you're next.
Can you hear
Hi,
me?
Brian.
Hi, good morning. My question has to do with retirees, CalPERS retirees, being denied Social Security benefits, full benefits. A number of us have worked in Social Security, myself for 20 years and paid in, and my Social Security benefits reduced by 2/3 because I have a CalPERS pension. I don't think my CalPERS pension should have anything to do with the fact that I put 20 years in Social Security and I can't get my benefit as defined. So what's CalPERS doing to protect us?
I don't have an answer to that right now, Brian, but let me look into it and get back to you on that.
Okay, because basically with the law, they're saying that if you have a government pension and didn't pay into Social Security, which is a CalPERS pension, that you're not entitled to Social Security benefits. And I get that if in fact I didn't put 20 years in Social Security.
No, I understand what you're saying. I do understand that, and I didn't know that they reduced it by that much. And so
Significant.
Right. I don't want to give you the wrong answer or
Okay,
the wrong thing about it. So let me find out and get back to you a much better answer.
okay, I appreciate it. Thank you.
Okay.
All right, looks like we'll move on to Rick Fray.
Hi, Mr. Fry. How are you? Long time no talk to.
Thank you very much, Yvonne. So I have a couple questions. I think they combine into both of them. My name is Rick Fry. I'm a retiree. The HMOs you mentioned are standards that Blue Shield will adapt. I'd like to hear more about what those standards are that will be adapted. Specifically, that I know that the PPOs or the HMOs offered health or was it gym memberships for free in several of our gyms. The PPOs have not offered free membership. I've found out they do offer some discount, but not as helpful as I would like. I would like to know what those standards are that the Blue Shield will be adopting, and is a free memberships for us with the PPO. Blue Shield will be having free memberships for gyms.
Okay, Rick. I don't know if it will have free memberships for gym because we didn't get down to that level. It's basically the standards that we have for patient outcomes, patient outcomes, patient care, making sure that they're getting the care. Trying to find the right word. Sorry, Rick. They're getting the care at the care that they need at the most reasonable rates and trying to keep costs down. And I wasn't aware of this, but you know, the PPOs had different standards and the HMO standards are much higher. And so having Blue Shield agree and health, included health, agree to those same standards is huge. But I don't know how it gets down to the granular level of what they offer. I will say that typically you find the gym memberships in the Medicare Advantage plans. And so it would be looking at the plans and looking in their plan design of what they offer.
And you don't work directly with Medicare, you just work with our insurance companies, not Medicare itself, correct?
Yes, we do not work with Medicare itself. Well, our healthcare team does, coordinate and work with Medicare, but no, we don't. As a board, we don't work with Medicare.
Okay. Thank you very much for putting on this town hall. I really appreciate the information you're providing.
Oh, thanks, Rick. And again, good talking to you again.
You're very welcome. It's great seeing you.
All right, it looks like next on the list is Carol. Go ahead and unmute yourself.
Hello, can you hear me?
We can.
Okay, great. I have a question for you. I'm a PERS retiree. I have 25 years in the system, but 30 years in law enforcement overall. I could not afford to stay living in the state of California at the time that I retired. And so I had to move. I moved to Arizona for cost of living purposes, but to still stay close enough to my family. What I'm curious about is I have only one option, PPO option for my health care because I live in Arizona through CalPERS. So my current premium for my husband and my daughter, who's 24 now, so she'll only be on for 2 more years, is right around the vicinity of about $2,300 per month, which is like more than a quarter of my pension check. And what I'm wondering is if and this is my first time ever calling in on something like this or watching one of your things, so I don't know exactly if my questions are appropriate, but I'll throw it out there anyway. If there's any discussion or concerns about other options that are less expensive. My husband's on Medicare also, but it did not reduce my premium. And we thought about getting him off of the policy and just putting him onto some other private policy. But when I investigated that with CalPERS, it would only reduce my premium each month by $10, which made no sense to me whatsoever, but that's where it's at. Is there any discussion or concerns about potentially providing any other options or other than this one PPO plan to out of state, retirees from California who move out of state?
Right. So, and let me just say that this is we have ongoing conversations about the plans that we provide and the costs and how do we expand. And you should know that this is not just something for retirees who live out of state, but also for our actives who live out of state. We have a significant portion of actives who live in Chicago, New York, Texas, and Hawaii. And so it's something that we, when I was still at Local 1000, we continued to advocate for, and I will continue to advocate for looking to make sure that we have the most cost-efficient plan possible for our folks who do live out of state.
Okay. And then just my own personal input on, I'll be honest with you, I'm a little surprised and at the same time a little disappointed to hear discussions regarding climate change. I understand the investment aspect of it and the companies that CalPERS is investing in or is shareholders in. I think that just so you have my input, investments that rule out, the traditional fuel industry type things, which have been long-term, pretty stable investments, I think are a better way to go. And I think that green energy in general, especially right now, is a lot more risky. And I'm hoping, because it's like making my heart race to think that we would get away from things that have been traditionally been building CalPERS investment wise to the extent that it has, that we would roll the dice on green energy with it being so completely unstable, in my opinion. So just so you have that.
Thank you, Carol. I appreciate your point of view. Let me just say that at CalPERS, the board doesn't just roll the dice on anything. We make very conscious, strategic decisions on where and how we invest. We have a fiduciary duty to make sure that we are investing and getting the funds that we need to be able to continue to pay out pensions, not just today, but long into the future. I think it's actually prudent for us to look forward and say, because just like coal didn't last forever, just like US Steel didn't last forever, right? To not wait until they get to the end of their run, but make sure that we're looking ahead and diversifying ahead, and making sure that we'll still be able to make our commitment to the retirees that we serve today, tomorrow, and the next day.
I appreciate that, and there's so much to unpack there, but I don't think this would be the proper forum. So I think
I appreciate
and
that,
I thank
'cause we
you
could go
for your
on and on, but
information. Yeah,
I
But
do
thank you for the
appreciate,
information today.
yeah, and I appreciate you bringing it up. I think that, it's a conversation that we should have ongoing, right?
Sure.
Okay, it looks like Ms. Deanda was able to put her question in the chat since her audio wasn't working. It says, if I decide to leave the country when my husband retires, looks like to Mexico, can I still utilize my medical in Mexico, or do I need to come back to the US?
I don't know. That's a good question, and let me find out. And I'll have somebody on the team get back to you with an answer. Or you can call the 800 number and call into the call center, ask that question, and I'm sure they'll be able to give you an answer much faster than I can today, because I don't know.
Okay, it looks like William, you're next. You take yourself off mute, you should be able to speak. William Stewart, in case there's.
There we go. Okay,
Oh,
can
there
you hear
are,
me?
William. How are you today?
Beautiful. Very good. Thank you, Board Member Walker, for giving us this opportunity to meet in a town hall meeting. I appreciate your heart and your effectiveness. I have a question that's nearly identical to a previous caller who is out of state retiree living in Arizona. I'm living in Texas, same situation. I met with online the Pension and Health Committee in September 2022, and I think around March or April of 2023, presenting the question that she posed, which is, I guess, first point, out of state retirees seem to have one and only one health benefit plan option. The second point is that Platinum Blue Cross Blue Shield PPO option is extremely expensive. And the question is, can we get a lower cost health benefit plan option? And they said that they would work on that. I believe the wheels may be rolling. Understand that it takes a long time to work through and negotiate with insurance companies to see what the costs are going to be and the cost benefit to both the retirees and CalPERS and the insurance company. But it has been a number of years, and I believe that we are appreciating and trying to be patient as our bank accounts are being drained and going into the payment of health insurance premiums, specifically the Blue Cross Blue Shield Platinum, because that seems to be the option. And I appreciate that you're aware of that. Could we find out what is the next step so that we can get in closer communications to possibly speed up that lengthy process so that maybe if we're not going to receive a lower cost health plan option next year for 2025, because open enrollment is going to come up in just a couple of months, can we get it for 2026? Or is it hopefully not going to be, we're working on it, and each year we're working on it, and a decade from now we're still working on it because there's so many obstacles? Thank
Right.
you. That's my question.
Right. Well, I will say that unfortunately, the answer will always be we're working on it, and hopefully making incremental changes as we continue to work on it. And it is not just based on my experience when I was representing actives. This has not been as simple as I would have envisioned it to be. I do know that the team at CalPERS, it's something that they're not only aware of, they're, chipping away, trying to be innovative, finding different things. We're not there yet. I will continue to push, and I will continue to report out. I have some ideas, but not ready to, talk about them. But I will be honest with you, it's going to take all of us, not just the retirees that are out of state. It's going to take, I believe, a coalition of retirees and actives that are out of state, and to come up with potential solutions to getting those costs down for our members. But I am focused on that because I recognize just how much the cost is.
Thank you. I like that word coalition. And so I will stay in communication with you so that perhaps we can, or through your office, we can reach more
Work on it
people,
together.
particularly out of state retirees, so that it doesn't appear when I go to the pension and health committee that there's only a me. There's
Right.
actually a large number of people. I don't know if anybody knows how many people are affected by this, and that might be a way for us to gain some voice.
Right. Right.
So thank you very much.
Okay.
Bye-bye.
Great. It looks like next on our list is Alfred. You want to take yourself off mute? You should be able to speak.
Boy, that came up quick. I guess, not that as many people in line as I would have thought. First of all, thank you for this forum. Is this a first ever?
No, this is a second. We did one.
Okay.
It's like every other month. I wasn't sure how it was going to go, but I actually enjoy it. I hope you do too, and we will continue. I will continue to do it as long as you guys are still interested, and learn as we go, make whatever adjustments we have to make. But my commitment to you is I will continue as long as you guys are all interested in continuing.
Okay, and I feel like I'm learning things here, getting different perspectives. I am a retiree after about 35 years, and I guess not just a retiree, not just receiving CalPERS pension, but also being a local taxpayer and living in a local town here in California. It's kind of like I'm almost have two sides of concern here, because I also hear local city council people talking about how much they have to pay for their share of CalPERS, and that they're facing having to reduce other services in the city. And so I guess for one, it really bothers me sometimes when like with the there was a development out by Santa Clarita where CalPERS bought high and sold low, and and for something that they shouldn't have gotten into, and that one bothered me. But I guess I would really hope that our investments can be careful and that we to avoid putting undue burden on our local cities. And it might even have to be come if political pressure gets to be too bad, it might have to be considering not asking the um, local cities to pay quite such a large percentage. Um, or, I guess I'm trying to say that they shouldn't necessarily be looked upon as a backstop for bad investment decisions that CalPERS makes. And in fact, actually, one of those that I'm worried about is the fossil fuel companies. I'm glad we got out of coal, and I think it's well worth keeping an eye. That sounds like you're doing on the various fossil fuel companies that are going to go down eventually, and sitting on assets that they may not ever be able to use. So anyway, thank you.
Thank you, Alfred, and I appreciate that. Let me just say that you struck something that is very near and dear to my heart. And for me, it is about retirement security. CalPERS has never, and they do not, pass on anything to the cities and counties and local agencies that are in CalPERS. And they have talked about for a very long time the burden of having to pay CalPERS. Well, it's not a burden that they have to pay CalPERS. It is they have to keep the commitment to the employees that they hired, right? They negotiate with their employees and say, we are going to provide this, this, and this, and then when the bill comes, it's like, oh my goodness, we can't pay it. Well, that's not a CalPERS problem. That's a city, county, and local agency problem.
Okay, that's a good point. Thank you.
Yeah, and I will say that was one of the drivers behind PEPRA that Governor Brown moved, because what would happen is a lot of the cities and counties would not pay CalPERS. They take vacations on paying their obligations, right? And then they'd get into a bad time and the obligations are still there. And so they eliminated their ability to take vacations on paying their CalPERS obligations that they have contracted for with CalPERS, right? And so we just have to be really careful. And I understand wanting to be, because I'm both a taxpayer also in my local area and looking at it from both sides. But this has been an argument that has been around for a very long time. And one of my commitments is to make sure that we're talking about it in a way that as you're out there in your communities, that you have the ability to have the conversation back. Okay. But I assure you, this is not a CalPERS problem. This is your local government's problem. And they have to own up to that, and they never do.
Thank you for that perspective. I mean, certainly very well aware of a number of our big companies in the past that had, good pension programs, and then perhaps investors, bought them up and hollowed them out, and they went bankrupt and no longer able to keep those pension obligations. And that's scandalous. And I think it's important that we keep keep that in perspective and not avoid being in the same situation. So you're right. I think that dialogue is very important. Thank you for your perspective.
Absolutely. And I have been, like as I read and everything else, but there's a trend that's starting, that a lot of the big companies that used to offer pensions, defined benefit pensions and everything else, they're realizing that by not offering them, it has created an impact on their ability to attract people to come work for them. And they're starting to do like a hybrid, right? It won't go back to the standard defined benefit, but they're starting to do a hybrid because they're recognizing that providing that is just as important to getting good workers as anything else, that their human infrastructure is just as important as everything else as it relates to their bottom line. And I look forward to that trend growing and people understanding that.
Okay, thank you.
Thank you. Steve, it looks like you're up next. I have taken you or allowed, hold on a second. There you go. You should be able to unmute yourself now.
Thank
Hey,
you.
Steve.
Hi, how are you? Let's see. First off, I know we've had several discussions about global warming and investments. I think 7.8% return is great. And I think looking at the future is a good idea, but I think we have to weight it and look in terms of investment for everyone, plus getting ourselves more fully funded.
Right.
So a combination of both the future and the current.
Absolutely.
75% funded is not real high. Has that gone up since 2008?
I believe so. I don't know.
Okay. All right. Because I know, I mean, I work for, well, like everyone, we work for public agencies. I mean, there's some that are close to 90% funded, and there are others that are about 40% because
Right.
you said they took a vacation. So,
Several.
yeah, I know exactly. The one question I have regarding health insurance is currently I have a Blue Cross Gold plan. Mine's retirement. My wife is an active one. Mine, or actually, I should say mine is a supplement. Will the Blue Cross Gold, something similar, go through with Blue Shield? Will they have similar plans to the Blue Cross plans?
Yeah, our gold and platinum are both going to be yes. The short
Okay.
answer is yes.
Okay, great. Then now that's perfect. And the other is the way it stands now, and I don't know if this is true with everything, but CalPERS is the administrator for my Blue Cross plan, which may only be the company I worked for. I don't know. If that's the case, will they end up being the administrator for the Blue Shield plan, or will that go back to Blue Shield as the administrator? Has that not yet been determined?
Yeah, no. So, we are, because that's our self-funded plan, right? And so
Yeah.
that's why we contracted with Blue Shield and Included Health.
Okay. All right.
And
Very
they'll
good.
take care of the day-to-day of it.
All right, I appreciate that. I'll get off the horn here so some other people can speak. Thanks.
All right. Thanks, Steve.
You bet.
All right, next in line, we have Mark. You should be able to come off mute.
Thanks for taking my call, and I appreciate your town hall. Again, my name is Mark Flan. I'm retired. I live in Arizona now. So as a follow-up for those of us who live out of state, can you kind of describe the work that's being done or what's being done behind the scenes to try to get us more coverage options for healthcare for those who live out of state? And what's going to happen in 2025? Are we going to have any new options available?
No, you won't have new options available. No, at this point, I cannot describe the things that are being done and how we're looking at it. But what I can do is commit to having a forum for just the out-of-state folks to talk through and to have a more focused conversation about this. I can commit to that.
Do you have any idea of what the percentage of people are that live out of state?
No.
Is that available someplace?
Yes, it is. Yes, it is.
Thank you.
Right. And I will say, just so you guys know, that sometimes when I say no, I don't know about the percentage or anything like that. For me, everything is absolutely important. And so I focus in on things when I'm dealing with things. And so just off the top of my head to tell you the percentage of people in X, Y, or Z, or the numbers in X, Y, or Z, I might not have them off the top of my head. Doesn't mean that I'm not aware of them. I just can't call them up though and do it out. I only have so much bandwidth.
All right, it looks like next on our list is Eric. Eric, you should be able to come off mute and ask your question.
Yes, hello, thank you. Eric, 32 years, City of Thousand Oaks, retired since 2019. I currently get many prescriptions through Optum RX. And then with that changing, is there a mail order system for Blue Shield? And will the transition be smooth? Will Optum RX provide all the information to the new system? Thank you.
Yeah, and you're not going to have to change from your Optum RX. That's still our pharmacy choice at CalPERS. I
Oh,
also get
fantastic.
my prescriptions through Optum.
That's great. Thank you so much for having this.
Okay,
Bye-bye.
bye.
Great, thank you. Okay, looks like next we have JC. You should be able to come off mute now.
Hi, my name is Jason Myers. I'm a retiree. I'll keep this quick since it's already been mentioned, but I'd like to add my voice to those who are calling for more affordable health plan options, especially HMOs, for those of us living outside of California. Thank you.
Thank you, Jason.
I believe, Barbara, you are next on our list, so I have unmuted you. Barbara, are you there?
Yes, I am. I don't
Awesome.
have any questions, but I'm listening to everything and taking notes.
Okay.
Oh, thank you, Barbara.
All right, then I think next would be Phyllis. Go ahead, Phyllis.
Thank you. First of all, I do want to thank you both for your time and effort. And Yvonne, hello.
Hey, Phyllis, and surprise, I will see you on the 1st of July.
Got that right. Hot Dogs Anonymous. My thing is regarding to Tesla. As we know, they have been sued for many inaccuracies within the construction of their vehicles, including dangers of having accidents where the vehicles are not performing correctly. That's
Phyllis, you're
number one.
coming in. Phyllis, you're coming in. I can hear you talking, but it's not clear. Can you get closer to your mic?
Is this any better?
Marginally.
Okay. I'll speak up. I'll use my outside voice, so hold your ears. Tesla has been in many deficiencies based on their improper construction of the vehicle. People have been hit by it, other vehicles have been hit by it. And the other thing is, I'm on a fixed income. I can't afford high electric bills. They're pushing that you can do it at home or at an outside electric source. My bill, for instance, is very cheap. I wouldn't want an electric vehicle to make it 2 or 3 times as much my voltage use. So therefore, I said, let's be very careful where Tesla is concerned. Thank you.
All right. Thank you, Phyllis.
Thank you for
And
your
I'll see you on
comments.
the 1st.
You got it. And thank
Okay.
you both.
I believe next on the list is, is it Wissam? Is that how you say your name? I apologize if I mispronounced it.
Yes, Wissam Altuaji. Can you hear me?
Yes, we can.
I'm also a retiree, of course. And thank you for making this town hall. And I would appreciate it in the past, before COVID, it used to be in different location in Southern California and California. So I think we should go back to that so we can contact you in person instead of on the line. But I think I asked you that question during your election, but I haven't heard back. I asked the staff and I asked the board to have a comparison between the Medicare prices, like for example, a Blue Cross, Anthem Blue Cross, between what's available on the market under separate Blue Cross, Anthem Blue Cross plan for Medicare, and between what Medicare is doing. The cost of Medicare is supplement over $400. I just checked this morning again and again with Anthem Blue Cross. It's about $200, and it didn't include the Plan D for the prescription. The prescription plan varies from $0 to $100, depends on the medication you need. So why is CalPERS plan almost double the outside market? And I asked you that question before. I don't know if you remember from the time of the election. So would you please have a statistic comparison, the two, and what's the reason for the discrepancy? Because when I talked to staff on multiple times, they couldn't give me a real comparison. And ultimately, I spoke with the board. They were supposed to have somebody call me and explain, and nobody did. That was about 2-3 years ago, before your time. So I appreciate it. And
Okay, let me work on that.
and I don't know if you remember that conversation or not, but this is exactly, if you need some more information, I've been in it for a while, you can contact me. We can have a dialogue separately and not to take the time of other people.
Yeah, okay. Yeah. I appreciate that, Wissa.
Thank you.
Okay.
All right.
And just, oh, no, go ahead.
No,
and I'll do it
please.
at the end. No, I'll do it at the end.
Oh, I was just gonna say,
we got
we're
5
approaching the
minutes? We're at
4-minute,
the end.
yeah. We're
Okay.
close to the end, so I don't know if you want to take maybe 1 or 2 more questions, or you want to conclude. What would you like to do?
Actually, I got some things I want to do in wrap up.
Wonderful. Go ahead.
Okay. So again, I want to thank everybody for being on. And as a reminder, I think I said this on the first town hall, but I will say it again. The reason why I started these initially is because I was going through a health issue and was not able to be out and be around and everything else. I'm in a much better space now. And so I will be out a little bit more, but I do appreciate people, the grace that you've given me as we're going through this. And I did learn through the first town hall the importance of getting us all together, which is why while I'll still be, while I'll have more of an opportunity now to be out, I will continue these town halls. I find them very important and hear things that I might not necessarily hear at individual meetings. I want to say that for those of you who want to have a fuller conversation, a longer conversation than we have allotted, you can email me at Yvonne, YVONNE, .Walker, WALKER, at calpers.ca.gov. And if you send me the best number to reach you in, I'll call you back. But just email me. Again, it's Yvonne, YVONNE, .Walker, WALKER, and at calpers.ca.gov. And I will, oh, thank you, Renee, see? And email me your phone number, your name, I will get back to you, I promise. There's 2 things I'd like to close with. I got an email from Jim McRitchie. I'm sure some of you know him. He was relating an experience that his wife had. She had lost her primary care physician, had retired, a little while back, and she was not pressed to get a new primary care physician. It was during COVID, everything else. And apparently, she had gone to the doctor, and apparently Jim related that there is a requirement to see your primary care physician at least once every 3 years to maintain non-emergency medical services. So I promised Jim that I would bring this up. I do have Don Molds. I'm looking into this because it didn't sound right to him. And so, I'll report back to you on what that is, but I just found that incredibly interesting. She was still going, she got her vaccines and everything else. She just hadn't chosen another primary care physician. It was during the time of COVID. So anyway, I promised I would relate that. And then lastly, as I close, I am sure a lot of you knew Neil Johnson. He was a former Local 1000 member and then subsequently a retiree. He died in March, and I was unable to speak about him at the time. But I just wanted to share before going off that when I was elected to be the chair of Bargaining Unit 4 in Local 1000, Neil Johnson was the chair of Bargaining Unit 1. And he took it upon himself to take me under his wing and make sure I knew what I needed to know to be successful. My whole time as chair, vice president for bargaining, president of Local 1000, and ultimately retiree representative on CalPERS, Neil was always my quiet champion. He offered me support, cheerleading, kicked me in the ass when it was necessary, wisdom and friendship. He was my healthcare guru, and the one constant that I thought would always be there. So I would like to close this meeting in honor of my friend, Neil Johnson, and like Forrest Gump said, that's all I have to say about that. And I will talk to you guys at our next meeting. Thank you for coming on.